everyone, and welcome to Genome BC's Data Literacy webinar series. My name is Joanna Hollander, and I'm the Director of Data Science at Genome British Columbia. While we meet today on a virtual platform, I would like to take a moment to recognize and acknowledge that I live, work, and raise my family in Vancouver, British Columbia, which is on the unceded traditional territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. Last month, we kicked off our Health Data Access Platforms in BC mini-series with a presentation on the iHit platform by PHC Ventures. Today, we're excited to continue the series by exploring two additional platforms, the HDPBC by the Ministry of Health and PANDA by PHSA. Now it is my pleasure to introduce our speakers. Shirley Wang is the Executive Project Manager of Strategic Data Initiatives at the Ministry of Health. She has been with the ministry for over 20 years, and she is now leading strategic data projects that will pivot data and information management and governance and supporting analytics infrastructure in the province. Dinky Takar is a Program Director for HDPBC at the Ministry of Health. She brings over 12 years of experience in product and service development across the US and Canada. With a strong track record of leveraging data and AI to lead innovative solutions in insurance, marketing, and healthcare. And last but not least, Penelope Nika is the Director of Data Platform Architecture, Operations, and Special Projects at the PHSA. With more than 25 years of experience in healthcare, Penelope has played a central role in advancing digital health solutions, including critical digital tools during the COVID-19 pandemic, integrating data system into the provincial immunization registry, and now leading the implementation of the PANDA platform. I look forward to hearing from all of you about these platforms and how they enable cutting-edge research, foster collaboration, and drive improvements in the health outcomes across BC. Dinky, the floor is yours.
Perfect, thank you. Then I'm going to go ahead and share my screen here. And before we go ahead and get started, I would also like to acknowledge I'm speaking from the 1515 Blanchard building here in Victoria that sits on the land of the Tongan-speaking people and neighboring nations of Esquimalt, Songhees, and the Seneca peoples. So what we're going to do is we're going to be spending the next hour talking about two distinct data access programs. The first one is Health Data Platform BC, or what I'll refer to HDPBC throughout the presentation. And the second one is PANDA. We have three speakers, like Susanna mentioned. I'm going to kick us off here talking about HDPBC, and then I'll be passing it to my colleagues here, Penelope and Shirley, who will be talking about PANDA, as well as also some other ongoing sector-wide initiatives that are currently in progress to improve access to health data. So first up, talking about HDPBC. So starting with Health Data Platform BC, what is HDPBC? It's a data access program that started about 5 years ago in collaboration with health organizations across BC, with funding support from BC Support Unit, CIHI SCORE, as well as federal and BC government. In a very simplified sense, it is a data access program that leverages governance policies and processes from the internationally recognized 5 SAFEs framework. And it supports both case level as well as population level analytics as well as research. The program itself, the Health Data Platform BC, it is powered by Trusted Analysis Environment, or TABC. And we'll talk about TABC here in a bit. So if I go to the next slide, TABC is the cloud-based secure environment that underlying supports the data access program, which is HDPBC. What it provides is a cloud-based secure environment with access to linked de-identified data via remote desktops or virtual desktops. So what that means is, instead of when you request access to data, instead of preparing project cuts of data, what this does is it invites you into a virtual desktop environment that is already loaded with a bunch of analytical tools like R, SAS, Python, etc., and has a database where you can access that assembled, linked, as well as de-identified data. In addition to that virtual desktop and that data access, you also get access to some user guides and how-to documentation that kind of helps you navigate this virtual desktop. It also provides code examples. It provides any data quality issues that we are aware of for the data that you are being provided access to, as well as some additional tools inside the environment or inside the virtual desktop to get some near real-time tech support if needed. What is important to note is the environment has no internet access. So that's the way to kind of make sure that the environment is secure. However, just because it doesn't have internet access doesn't mean you can't do a few things. So, for example, HDPBC already has a lot of contributed data from different data contributors across the health sector that you can get access to. We'll talk about the data sets that are available here in a minute. But we do understand that not all projects can use the or do the analysis or research with the data that's provided by HDPBC. So we also offer an additional service, what we call is bring your own data. So what that means is you could access data that HDPBC as a program offers, but you could also, for your own projects, bring any additional data that you might require for analytics or research into the environment. Everything is encrypted and brought in through SFTP. Once you share the data that you want to bring in as part of your project, all the data transformations, encryption, matching, or any linkage will be done by the TABC team. And you will get access to that data inside that virtual desktop. How you access that virtual desktop is through login credentials, and it sits behind an MFA. One thing to note would be for privacy and security reasons, anything that comes inside the environment, like BYOD, or if you want to take any aggregated statistical products out of the environment based on your project, those are also human reviewed. So anything coming in or anything going out is human reviewed. And as long as your project team is working through the virtual desktop inside the environment, you get access to all your data in a single place. So we talked about the program, which is basically how you get access to the data. We talked about the environment that supports that access. Currently, Health Data Platform BC supports 3 different types of projects. It's important to call out these 3 different types of projects because depending on which project type or project path you take, your access path or what are the governance or what are the steps you need to take to actually get approvals and access to the data vary slightly. So the 3 project types currently supported are organization projects, organizational research, and academic research. The key difference between these projects is who is the project team and what their affiliations are, again, following the 5 Saves framework, as well as what kind of data or what is your project type, what is your project aiming to do. So for example, or for organization project, your principal applicant needs to be an employee with either the Regional Health Authority, a PHC, PHSA, or health, basically any of the health organization. And more importantly, the project needs to make sure that the work that is being done is in alignment with the organization's mandate. So this is basically, in a sense, non-research types of projects that are happening within the health organizations. The other 2 paths are organizational research or academic research, with the key difference being the principal applicant's affiliation and the project purpose. So if it's a research where the principal applicant is affiliated with one of the health organization and the research is also in alignment with the organization's mandate, as well as is being supported by the organization that the principal applicant is affiliated with, it can take the organizational research path. But if it's an academic research, meaning the principal applicant is from a post-secondary institution, they could still go ahead and get access. They'll just follow the academic research path. Both when it becomes research, it does require approved ethics and peer reviews, regardless of which path you fall into. That's at a very high level, the 3 project types that we currently support as part of Health Data Platform BC or HDPBC. Next, what I'm going to talk about here a little bit is the overarching application process. So, like I said, there's a governance policy that dictates or that defines how you get access to the data that you're looking for. You have your TBC environment. Once approved, you will get access to all that data in that environment. The application process, however, will differ based on the project path you take. So there are some steps that you would need to do pre-submission, meaning how can you make sure that you can get your package ready or all your paperwork ready to go ahead and submit to get approval. And then once you submit that data access, there are some steps that happen to get you to approval. So first and foremost, you would need to determine which project type you are, whether you're org, whether you're org research, or whether you're academic research, based on your project purpose and your principal applicant affiliation. Depending on which project path you are, so if you're org or org research, we have some point of contacts that are defined for each organization that are on the website, and it will be linked in this presentation when it's shared. So you could reach out to those point of contacts to get any support during your application process. If you're academic research, you start with HDPBC, and they will be the ones providing the support through your application process. There are some prerequisites when it comes to these projects. So for example, if it is an organizational project, so this is any non-research work that you're doing as part of your affiliation with the health organization, and it is something that aligns with the organizational mandate, you would need to get approval from an organizational designate of from the sponsoring organization. So for example, if you are somebody at Fraser Health who wants to do some work, we have identified organizational designate for each of the health organizations. So you would need to work with them and get approval if Fraser Health, in that example, is sponsoring your project, to get approval from that organizational designate as part of your application process. If it is academic research, the process kind of stays what it is currently, where you would need your approved ethics and peer review before you can go ahead and submit the data access application. If you're organizational research, you need kind of both. So you also need, in addition to the ethics and peer review, which is a research requirement, you would also need to get approval from your organizational designate of your org to get confirmation that it aligns with the organization's mandate work. So those are some of the steps that you need to take pre-submission. Once you go ahead and finish all the prereqs, you can submit your application. The application goes through the approvals process. What is kind of different with the approvals process here is Health Data Platform offers multi-org data, meaning we do have data from different health organizations. And in order to help accelerate and expedite the approval process and also streamline the approval process, one of the things that we have implemented is we have established a Health Data Council. Health Data Council basically comprises of representation from all the regional health authorities, as well as Providence Health, PHSA, Ministry, and First Nations Health Authority. So it has representation from all the health organizations. So when you submit your access request, depending on your data needs and depending who your data steward is, instead of getting multiple approvals, your request goes to that single Health Data Council and is approved through the Health Data Council once. So it doesn't require all those multi-approval processes. The difference there is if you are research, given the legislation for HIPS and PharmaNet data, in addition to Health Data Council, you would also need to get approval from the Data Stewardship Committee. So again, it's all internal processes. Once you submit your access request or your application, you'll be kept apprised of where it is in the process. And internally, the team will be responsible to make sure that you're getting all the approvals that you need. Once you have all your approvals in place, you will be getting ready to access the data in HDPBC. There are some additional onboarding requirements, like for finishing privacy training, for example. Or if you're bringing your own data, the team will work with you to make sure that you are set up to bring your data inside the environment and you are all set up and ready to access the data and start the work. Generally, from a timeline standpoint, the pre-submissions to get all your approvals through organizational designate could take somewhere between 1 to 2 months, depending on your type of your application and who you're working with within your org. And then as far as the approvals go, we are currently looking at a timeline of 1 to 3 months. The council meets every month. So we do try to make sure that if we get a clean request, we can process it as early as we. So that's kind of end-to-end the application process. Talking about the data holdings, we currently have over 30 data holdings, including about 22 patient surveys. We don't have social data as of now, but we are looking at getting some additional social data from other ministries here in the upcoming months. But what is different about this, right? So what I do want to focus on is, what data do you get when you request a data holding? And this is different than getting the data extract. So instead of filling out checklists and instead of filling out all the columns of each data set that you're requesting, the difference here is when you request data through HDPBC, what you get data set, you get by default all the reference and population data sets. And in addition to that, for any requested data set, you get what we call core data. And what this means is, I'll use that as an example. If you were requesting that data set, you say, hey, I want all the core data for that. You just get a set of columns that are already pre-approved. And hence, you don't need to fill out any checklist, or you don't need to tell us what the columns are. You'll get all the columns that we have deemed to be core data that we have seen historically is what the data are the columns that are requested. However, we do understand and appreciate that not every project is made equal, right? So there might be some additional columns that are not included as part of core data that a project might need. So we do have those additional columns and what they go through a process, basically what we call as additional approval required, meaning, and it's literally a checkbox on your data application, where if you require any non-core data, you just need to help us understand what those columns are and provide justification as to why for your project those additional columns are required as part of your application process, so that when the Health Data Council is reviewing, they'll take those into account as part of their approvals. From a data coverage and currency standpoint, currently we have longitudinal person-specific data on the BC population, which is basically approximately 4 million residents. Most of our data sets cover the last 10 years, with some data sets going back as far as 30 years, up to 1991. We also understand that projects require more latest data. So we do regularly scheduled refreshes for all the data sets that we offer today. Again, throughout the slides, there are quite a few links to the Health Data Platform BC website that will give you more detailed information about the data holdings. So what are each of the individual data holdings, all the metadata associated to that, column names, all that good stuff is available on the website linked below. We'll share it as part of the presentation after this webinar. So one of the other things that I do want to call out is we talked about the program and we talked about the environment. This is slightly different way of working. And the reason why we think this is going to really help is because you're invited into a secure environment. You get access to all these tools and applications within the environment. You also can get access to additional compute resources because it's a cloud-based platform. We by default offer CPUs with 16 gigabytes RAM as standard. but there are options to request higher RAMs, or in future, there will be option to request GPUs, given the type of the work and the project that's doing their work. In addition to the compute resources and the tools that are offered within the environment, there are some other resources available within the environment that actually helps and supports collaboration across projects. So we have GitLab inside the environment. Like I mentioned, it has a lot of code examples and videos and how-to guides that not only is provided to each project, but it also enables for any project to share any insights if they would like with the HDP team as well as with all the other project teams. There are Git repos to collaborate with all the users that are in the environment, but there are also Git repos for the project, meaning if you have 4 or 5 project team members on your project team, you all get a GitLab or a Git repo inside the environment where you can collaborate and share and work together easily and seamlessly within the environment, given it's locked off out of the internet. So finally, before I pass it to Penelope here, I did want to talk about where are we today with Health Data Platform BC. So we started about, like I said, 5 years ago, and at the time, the only project type that we were supporting was organization. So given that history, we have about 41 organization projects. We introduced the research stream for both organization and academic research last year. And we have about 14 projects for research as well that we are supporting, which enables about 160 plus users in the environment as of today. One other thing or other metric that we are really proud of and hoping that this will streamline the access process is once you have an approved request, you can get access to your data as soon as 3 to 5 days once the approval is received. I also talked about ability to bring your own data in or ability to take data out. And for security reasons, we do human reviews of in and out. And given that it is human reviews, we do try to make sure that the SLAs for those human reviews are not adding to the project timelines. And at this point, we are looking at about 3 days average time for approvals. And we have had about more than 97 requests to bring data in the environment. And we are talking about 250 requests to take some aggregate data out of TBC. So pretty high volumes, and we're still able to kind of support them with about 3 days average approval times for those. So all this information is available on the website, and we'll share the links. So feel free to browse. And if there are any questions, we'll take it at the Q&A. And with that, I will pass it to Pam.
Thank you, Dinky. Seeing how this is remote, I do want to acknowledge that today I am seated on the unceded territories of the Squamish, Musqueam, and Tsleil-Waututh nations. All right, I'm here to talk about PANDA, which is PHSA Response for Analytics and Data. It does stand for the PHSA's Platform for Analytics and Data. It's an integrated platform that provides data, governance, tools, and services to support reporting and analytics for programs and PHSA programs and users. And really, if you're on a call today and you're a PHSA employee or a researcher working closely alongside a PHSA program, PANDA is potentially a solution for you. So similar to HDP, we ingest data sources from the different PHSA programs. In that internal PANDA team zone, similar to HDP, our data engineers are the ones that ingest and transform and model the data for the different programs. But unlike HDP, if you see the top section there in the analytic user zones, we do have a program data zone. So this contains data collected for a specific PHSA program where they have oversight of the access, use, and disclosure of that data. As long as the criteria or model is consistent with the PHSA policies, PHSA data governance framework, and any other related standards. So they have their own data in that program data zone. It may be identifiable if they choose to give their users identifiable row data. Down below, they contribute. So if they have a data set in their program data zone, they may contribute it to what we call our linked data zone. So in my mind, I see it like a playground. You know, you've got your own toys and you may share some of your toys in a larger playground. So this is very similar to HDP, where again, our data engineers link all the data for you and you get granted by default access to de-identified data. And in this area, DARE has central oversight of the access, uses, and disclosure of that data. Both of these zones in our analytic user zones, where HDP has TAE, we have what we call PANDA PAWS. It stands for our PANDA Analytic Workspace, where all the analytics are done within this environment. So it's an Azure virtual desktop. You go in there and you have access to this very similar tools. You get POSIT, you get SAS, you get Python as well. So similar to HDP, you've got tools, and it is a very, it's an environment that's secure. So we do also have services where you can bring data in, or if you need to take the data out, well, not data, sorry, outputs, you take the outputs off the platform, because theoretically, everything that you need to do should be within that environment. We also have a reporting zone at the very far right, and this is where programs can develop dashboards, visual dashboards for their users, and it can be published, and they don't have to be users within the PANDA Analytic User Zone. So if a program out there wants to show how they're doing to their own users, we give them a subsite and they can publish their dashboard there and show it off. Next slide, please. So what this does is, because we have data from all the different programs, we enable data across the continuum of care. By doing this, you get this longitudinal view, and if you can see the history of patients, you can then help predict the future and model things to be different. So what it does is provide a holistic view of patient and system data to drive continuous improvement in the service delivery. We do share information with HDP, so there are some there are also some data sets in here that are from the ministry. They're administrative admin data sets. So we do receive, and we also submit to HDP as well. Next slide. So from our standpoint, for our PHSA programs, we've got about 30 PHSA programs who are using our platform today. We've got about 100 different data sets used across 53 data marts, which is about 30 terabytes of raw data that we bring in. Those analytic PAWS, the PAWS platform, we've got about 80 virtual machines to support them, all loaded with different tools. And in those reports I was mentioning, we've got about 500. In order to request a data mart, we do have a PANDA portal. So if you're on the call today and you're a PHSA program and you're wondering, how do I get started? How do I request one? We have a PANDA portal SharePoint site that you can go to, and there's a very well-established process where you go and request, you start a data access request where you indicate, this is my program, this is my, these are the outputs I want, this is the purpose of the data mart, and these are the data sets I would like. It's very similar to HDP. We have what we consider, instead of core, it's called fast track eligible. So if you request a specific data set, there may be certain variables in there that are given to you along with the data set, but if they're not fast track eligible, there are additional processes to go through to request those. So that's it. I'll hand it back to Dinky.
Actually, I'm going to take over, Pen. I wanted to take an opportunity just to share some other related initiatives in the data and research space, just to give you a sense of all the efforts that we're doing in this arena. One of the projects that we're doing is we're moving projects that are academic research projects that use health data from the SRE to the TABC. POP Data has been providing this valuable service for over the last 30 years. And we recognize that the sector and the research have overlapping data and data access needs, and unifying these efforts creates some mutual benefits. If we align our goals, say in the areas of data governance and available data, those are areas that we can work together on in improving. We can also do more around coordinating our resources, so around training and metadata, for example, to support these mutual needs. And the big thing is also about sharing knowledge. And related to that is aiding discoverability. So things like code sharing and reuse. All of these efforts, we hope to sort of improve insight development more effectively and address data-related impact challenges with greater impact. I hope through the presentation you have seen some of the beginnings of our fruits of labor. So, for example, creating a single application and approval process through our collective governance efforts. What you saw earlier around our ability to have an approved request to get to 3 to 5 days. I hope that people can begin to see our real efforts around improving timeliness, process transparency, and more importantly, reliability of our services. But having said all that, we fully acknowledge that there's still much more to do here and that this is just the beginning of all of our work. On another front, the Research Approval Program process, which is RAP, is looking at the entire research approval process. So that goes from ethics, data access, privacy, operational reviews, contracts, and agreements. The opportunity here is how do we further streamline processes related to data across those different streams? Are there things that we can further do to harmonize processes, applications, and approvals? And this work is closely aligned with the work that we've just described for HDPBC. So you see overall alignment on the data-related pieces. Next slide. So what I wanted to take an opportunity here now is kind of draw all the pieces together. What we'd like you to think about is when you're applying for data access, we'd like you to think about 3 things. That is the people, the project, and the data. Who will be involved in the project? Who is going to be the lead or who will be the principal applicant that will be putting the data access request in? Your team members can come from a variety of organizations. Think about the project that you're doing. What will it be about? And then the data needs itself. Is it a single organization? Is it multiple organizations? Looking at those 3 factors that really determines our program eligibility. So as Pen highlighted earlier, it's really about serving the PHSA employees and their affiliates and really doing work that aligns with the PHSA organizational mandate. When we're looking at academic research, for example, we are encouraging people to come to the Health Data Platform to support their research needs, whether that be single or multi-organizational. And then for the organizational or sector needs that are crossing multiple organizations, we're leveraging the Health Data Platform, as Dinky showed you earlier in the stats. And if you're really unsure, both our front counters are well versed in each other's programs, and we're happy to take your call and direct you. Additionally, you also have points of contacts for those that are embedded in a health organization. You also have points of contacts in your organization that can speak to the process and the work that we're wanting to do. So I'm going to turn it over back to Zusa. So thank you today for the opportunity to present, and we're happy to take questions.
Thank you so much, Dinky, Penelope, and Shirley. I think it was a really great overview of what data is available, how the process is. And Dinky, I especially was impressed by the fact that access to the platform is going to be in 3 to 5 days after the approval. That's really well done, especially given the number of requests you're getting. And PANDA has done an amazing job to pulling together all the PHSA data. So amazing work there. And Shirley, I really appreciated your summary, because I was wondering as I was looking at it, how will researchers be able to access data? Who do they go to? But around the same time, I was wondering, Penelope, maybe given that you mentioned that you pull data from HDPBC, but also provide data to HDPBC, I was wondering if non-PHSA researchers would be able to access all the PANDA data through HDPBC, or would it be only a subset?
I should correct myself. We receive Ministry of Health admin data sets, so it's not that we pull from HDP.
Yeah. No,
it's that we do. So the question was whether non-PHSA researchers can access PANDA?
Well, not directly PANDA, but all the PANDA data through HDPBC, or will it be a subset of what's available in PANDA?
So whatever PHSA programs decide to contribute to the link zone and subsequently to with HDP is what's available to researchers in the HDP platform.
Okay.
So I would say no, because quite often some of their programs are still making sure that their program data is of like it's gone through data quality processes, and there's also making sure that there's good data governance and information sharing agreements put in place before they start to share with HDP.
Okay. Thank you. So we have some questions in the chat. For the audience, if you have any additional questions, please post them in the Q&A chat box. The first question, do you support the data management, data repository transformation and load of a college's research department? What is the limit of storage you can offer? And do you assist with long-term or short-term data storage? I'm assuming this would be for HDPBC, but
I will take a stab at answering that. Currently, we don't offer that, but we've had others ask about the service. I'm happy to explore that with folks that are interested in this idea. Right now, we would charge based on the size of the storage, because as Dinky mentioned earlier, we are on the cloud, and so for anything that is consumables like storage and compute, we're currently charged for that. So I'm happy to have Dinky or I would be happy to have a further conversation to explore that. We are open to those ideas, and we have been approached by other parties, and we are exploring that currently with other parties, but we currently don't offer that as a formal service.
Another question was, what is the advantage of keeping PANDA separate from HDPBC?
I'm going to answer that unless Pen wants to answer.
I think within PANDA, there's live data. So again, the programs have nightly refresh data of their own, which wouldn't necessarily be in HDP because you want to send more polished data to HDP.
Yeah, I think
Do
the
you have any
difference.
standardization issues too, or once that's not really a problem, surely?
I think Penn highlighted sort of the difference in the sense of the level of curation is how I'll phrase it, of the data, and also the currency of the data. I think those are the two biggest ones. For those that use near real-time data, you can appreciate that that data is less stable, right? Before it gets to what I'll call the final answer.
Yeah.
Things are happening in a very dynamic way. And so that curation will happen over time. Health Data Platform is more of a curated area. So once that record, I'll put in quotes, record is stable, and stable can mean a variety of things for people. It's to be able to assemble that curated data. I think the other thing that people have to think about for separate is we also have limitations with technology. The twinkle in our eye is truly a federated environment. The technology is getting there. So we are exploring some technology options where we can truly move to a single copy of the data in those areas where it's truly a duplicate, meaning an extract is held in two places. Technology-wise, we are not there yet. And so that is the twinkle. I'm hoping in the next 2 to 3 years we'll be there. But I think the bigger efforts is really around that curation of data, the efforts that you even suggested around standardization, things that we can do, particularly around master reference data to support data linkages across our data sets. That's sort of where our primary focus is right now.
Thank you. Given we're Genome BC, I guess we ought to have a question about genomic data, right? What type and extent of genomic data, if any, is available via the platforms? I guess
So
one.
The short answer is we have no genomics data. One thing that I didn't stress well enough in the presentation is Health Data Platform is a tabular environment. And Health Data Platform, TAE being a tabular environment, would be participating in a broader ecosystem of the data of other forms. So working with an image holding or working with a genomics holding, and really looking at the use cases to see if a tabular version of the image or a tabular version of the genomics data could be made available in a tabular environment for analysis. Conversely, is there situations where the tabular data may need to be co-located with the genomics data or the image data in order to support a specific use case? So those are areas for future exploration. We have some smaller projects happening looking at some of that, and the more we can better understand that, then we can figure out how would a broader data ecosystem work in BC to support multimodal analysis.
Wonderful. Penelope, I don't know if your answer is similar to Shirley's on the PANDA side.
We have very minimal genomics data, but maybe for some microorganisms, but not a lot.
Okay. Given that the first presentation in the mini-series one was IHID, I'm assuming that's where this next question is coming for. Is PANDA equivalent, I guess, similar to what IHID is for PHC?
Yes. It's PHSA's response, and this was endorsed by the executive leadership team at PHSA to make sure we have this one system, so we get away from those data silos. So yes, it's for PHSA, not for PHSE. Awesome.
Another question is for many investigators working at PHSA and also part of BC institutions. Would they be able to access PANDA for projects that they're leading or participating in from their institutional positions? Or the contact has to be with PHSA?
I don't know if you can unmute Mike Koss, and he may be able to answer this better than I, but from my opinion, is he on the call? He's on the call.
I don't know if Mohammed can. Oh, there he is. Mike?
Hi, yes, can you hear me?
Yes, perfect, thank you.
Generally speaking, PANDA projects are for efforts that do align with the PHSA's mandate directly and are supporting improvements to PHSA programs and services. However, there is a lot of research that's done in collaboration with academic researchers at UBC, SFU, and other places. And if there is a tight alignment with the PHSA goals and the academic goals, there can be the possibility. We do have a concept at PHSA that are it's called PHSA affiliated associates, a bit of a mouthful. And if somebody, say, is part of one of our research institutes and is involved in a project, that meets PANDA's scope, then it is possible to provide access like that. So we can have a conversation if there's a specific project and look at whether it meets the definitions, and if we can help in PANDA, or if HDP might be the more appropriate place for that.
Thank you so much, Mike, for jumping in. The next question, I mean, you partially answered, I guess, Shirley, but maybe it has a little bit more meat to it. Are there any provincial or Ministry of Health efforts to create a data platform for medical imaging or genomics?
The short answer would be not that I'm aware of at present. I'm not sure for us that's the right place for us to be, because that's not within the ministry's area in terms of genomics imaging. As I alluded to earlier, I really support the notion of a broader data ecosystem and really collaborating with the right partners, whether that be academic or with other health organizations, particularly in those areas.
Does a forum exist for users to share their experience with the platforms, HDPBC or PANDA? I guess actually this is a good question, but I don't know if that's something that you have set up for either platforms.
Yeah, I can speak to the HDPBC one. Like I mentioned in the presentation, there are a few different ways to contact the HDP team to share experiences. We have a central mailbox that you can send information to if you are inside the environment and you would like to share any experience, whether it's good or bad, like something is working, something is not working. There is way to submit tickets and feedback inside the environment as well. So there is something more inside and outside the environment to be able to submit any kind of feedback, experience, issues, questions, all of the above.
Yeah, I was also wondering if behind the question there was another one, like would the users of either platform be able to communicate with each other saying, oh, I've done this, this is how I've done it, you know, like code sharing, anything like that, where users can help each other as well, so they don't have to rely on you all the time.
Yeah, I'm being careful around how I answer because I don't want to say something that could be misleading. But yes, there are ways where they could share and bring information in and out of the environments to help with the project and the work. That being said, are there any forums that cross across the environments where they can collaborate with? The answer to that question would be no, given security reasons and the type of access to the data that folks would have on a project by project basis. They are, for example, HDP is disconnected from the internet, and so there is no way for them to collaborate outside.
That makes sense. Another question, can PHSA employees access the HDP virtual environment?
Yep. Anybody from any regional health authority or any health organization across the sector should be able to, or even an academic researcher would be able to access the virtual environment if approved.
In the future, will other data sets be included and when? I don't know if this is alluding to data sets from other health authorities or in general, other data.
I mean, again, the short answer from an HDP perspective is yes, we are constantly looking at adding more data sets to the available data holdings that we have. Like I had mentioned in the slides as well, we have about 6 or 8 data sets that we are looking at to bring into the environment in the next 3 to 6 months. And that's kind of a list that keeps growing.
Yeah, well, I could add to what Dinky's saying. So if you're looking at more specifics in the social sector, we're looking for people-based data sets, so education, children and families, social reduction, SCPR, social development, poverty reduction, so those on income assistance. We're also looking at corrections data, so adult corrections data. So those are the ones that we expect in the coming months. So hopefully by this time next year, wow, way before this time next year, we'll have that those types of data sets available. With respect to within the health sector, as Penn alerted to, we've been working very closely with the PHSA team and the clinical registries that are available there. On the regional health authority side, that effort isn't as apparent. We've been working very closely with them on drug orders from their CIS systems. That project has taken a little bit longer than I would like. So, but that's still one of the efforts. As Dinky also alluded to, we're working on bringing a lot of the surveys that have been completed. So, for example, the Office of the Seniors Advocate, that long-term care survey, and other surveys that are coming up, and the regular annual emergency department surveys, and what else? Oh, the overdose cohort. So those are something that the PHSA team has been working on, and so we're bringing that. It's really aligning with sort of the priorities that are happening in the ministry. So we've been, you'll notice a theme in some of the data sets that I've mentioned. So those are our priority ones. With respect to sort of gathering feedback from others, that's something that we still need to work on around a mechanism to collect your priorities from the research communities around other data sets that I've not mentioned. So we're still sort of working out those mechanisms and how we could collect that feedback to sort of inform now it would be next year's activity. So this year is more the ones that I've just mentioned.
Okay, thank you. Penn, any comments on your end?
From a PANDA perspective, we're still continuing to work with many of the PHSA programs like Emergency Health Services and continuing to work with the registries as well. Some of them do contribute data to PANDA. However, we're always continuing to add data, to model more data. So it's a continuous process to continue to add the data sets into PANDA. But yes, we're still
Wonderful.
working on it.
That's great to hear that on both ends there is extensions. I guess this next question was already answered, similar to the questions above. Shouldn't PANDA be a super node on the HDP? So I guess in the federated vision, that would be the case. Does the TABC has any scope of output data directly contributing to dashboards?
Again, that's an area that there's interest. So right now you see PANDA pushes to a reporting environment. That's sort of our future as well. We're really looking for a partner to help us identify what those requirements might look like. But right now we don't. We don't have an automatic feed that goes to a reporting environment. I don't know if Dinky wanted to add anything.
I think you covered it, Shirley.
Can you clarify how PubDataBC intersects with HDPBC? Is it the same or different?
Yeah. With respect to the SRE and the TAE, I would have to say that they're the same. From a technology base, they're different. From the way the data is offered, they're different. But in terms of the high-level concept and the services, they're the same. So they're both secure environments, meaning they have a lockdown environment in terms of access. We both have multi-factor authentication. So from that point, they're the same.
All right. HDPBC open code and open methods have been mentioned. Where are they hosted?
Yeah, so currently we have a version of GitLab inside the environment, and that is where we host a lot of those things. It is something we are also looking at making sure that we are structuring and providing the methods in a way that if needed, they could be taken out of the environment as well, given there is no access to the environment. We also make sure that we look at other packages and repos that are available, the public package or public repos that are available that you could then inside the environment download it for your project needs as needed as well. So it's all within the environment inside GitLab from a tool standpoint.
Awesome. I was wondering, there was excitement when we were having the IHIT presentation last time that the cost is free for PHSA, or sorry, PHC associated investigators. I was wondering if you can comment for PANDA or HDPBC what the cost may be.
Yeah, so for Health Data Platform BC, it depends on the type of the project that you would be working on. There is a cost associated currently, which is the same cost that you would be incurring for academic research. That's, I think, somewhere around $12,000 per project and your project needs. So there is a cost associated for academic research. However, currently there is no cost for organizational research projects.
Wonderful.
And for PANDA, PHSA programs, there is no cost to them today for use if they have a data mart. For research affiliated ones, we're still looking at what that operational model needs to look like. I think it would. What am I trying to say is researchers can't go shopping around and expect HTTP or PANDA to be cheaper. So when we do set something up, it'll be similar. And I think there's a lot of different things that we have to factor in and consider. So a lot of the compute or the storage or the archiving, the use of service management tools, things like that. So there's still lots for us to think about when we stand up this in PANDA for any sort of affiliated researcher. We have a couple demonstration projects going on right now to assess what that might look like.
Okay. And maybe around that, you mentioned around the cost and depending on data, like a few factors. But I was wondering, Pen, for if somebody, a PHSA associated person comes as, requests access to the data, they are approved, would they be able to bring in genomics data like, tabular or whatever format, like they potentially would be able to do for HDPBC?
If it meets the data governance requirements, and also I think it depends on what that data looks like. If it has to be linked, the engineers need to get involved to make sure that if it's put into a data mart, it's de-identified. So in theory, yes.
Potentially.
But there'd be additional steps to make sure that it's brought in securely and linked with other data appropriately.
Okay, wonderful. I just wanted to thank you, all three of you, but before the audience leaves, I wanted to say that we do have a data access integration analysis, or the acronym is DIA. The DIA 2 is going to be launching in August 2025. And it's going to be a very cool partnership. I don't want to say too much about it, but if you are interested in being on the mailing list for getting the notification when the program launches, please do email us at dia@genomebc.ca, and we'd be happy to let you know once that program launches. And thank you so much for the presenter, Shirley, Dinky, Pen. It's been amazing to hear about all the progress. Shirley knows that I get very excited about data and how anything related to data, how we can support researchers or organizations for the health system, learning health system. So thank you so much. I hope the audience learned something and will be able to be more confident in figuring out how to access data in BC. Thank you so much. Bye.
Thank you. Bye.